Hello, hello, hello. Welcome to my show, Tales of Endurance. My name is Hina Fatma, and I am an NLP Master Trauma Coach. And I am very excited to be hosting this first episode of my show. We decided to celebrate and honor women in this show. So before we start on that, I just wanted to share a little story. When I got pregnant for the first time, my husband, he just passed a comment because I was having a little nausea, the regular um, morning sickness. And he just goes like, well, what's the big deal? Every woman goes through it. And, why such a fuss? And I just looked at him and I went like, well, that's why it's a big deal. Because if you just imagine for a minute that you have to undergo this nausea, not being able to, digest your food or feeling like, vomiting whatever you're taking in. And it's happening every day. Every day you wake up in the morning and you have to go to work. And just imagine it happening for a week at least. Forget it 3 months or 4 months, what will you feel? And he looked at me and he had no answer. He was like, so just imagine if you wake up tomorrow morning feeling this way, and then the day after, and then the day after, what would happen? You'd just be frustrated. You'd want to just, you'd be upset. You wouldn't want to go out anywhere and do anything. I'm like, if all the women in the world face it, then we're all superheroes. You can't just say, oh, just because every woman face it, it's not a big deal. It is a big deal, and it's a big deal for each one of us. And that's why we need to be honored. We need to be respected. We need to be, appreciated, protected for these sacrifices that we make. We're trying to bring in a human being. And then I myself had a postpartum depression twice, both the times with my daughters. And so my very beautiful guest here, she also wears the same badge of honor. She's a mother. Courtney, how are you doing?
I'm good. How are you?
I am well too.
Thank you for having me. I'm honored. Sorry, that opening got me a little bit. Okay. So I too had postpartum depression. You could say it was with both pregnancies. One first child, one more pregnancy. Postpartum depression is kind of, it's not really a definitive term, I don't think, for that, but essentially mine looked like this, and it's not outside of the realm of normal, but it still wasn't caught as early as it could have been, particularly with my history. So I have a history of a mood disorder. I've had it since I was very young. It was diagnosed young. It has morphed over the years, I think, from being just kind of, anxiety and depression for a child into something much more substantial as an adult, moving into like the bipolar spectrum area, depending on who you talk to, how they want to define it, or if they want to define it, or if it's less about the definition and more the tools to work with it, to manage it. But my postpartum depression hit, and my son was about 6 months old, which is in the realm of normal, but I think I was feeling it before then. I just didn't entirely recognize what it was. And nor did anybody else around me.
And that's what happens with most of the women. I think they never know that it's depression, and they think it's normal because you're tired, you're just pregnant.
Yeah. And I want this to sound the way I mean it too, but I had a lot of experience going in with depression and anxiety and panic, and a lot of experience, and knew what it felt like, and had kind of studied up, if you will, for the signs of postpartum depression, just because I knew it was likely to happen for me.
Yeah.
The birth trauma was real, which I can get into in a moment. So it was kind of like we all knew and should have known it was coming, and yet it still hit, and we were all still like kind of blindsided. So the simplest way of explaining it is about 6 months, and then it took until he was about 9 or 10 months for me to actually get true treatment. I had been with a therapist basically since my child had been born. because I generally have a therapist because of my mood disorder. Because I usually have medication. I do use some Western medicine and medication to help manage it. I had a therapist, and she specialized in maternal mental health and was in the top of her field at one point, had kind of been the president of an organization in that region. And I'm not claiming she didn't see it, but I didn't get into treatment any faster by having her, if that makes sense. She's the one that recommended me to the program. She's the one that got me into the program, because without her medical, like, direct phone call, it would have taken longer for me to get in.
For
But
some reason, we try to give a benefit of doubt. You know,
yeah,
we believe we're strong, we're too strong, we can handle this. It's nothing.
yeah. And to your point, you're tired already. You're
Yes.
sick, you don't feel good. So, and you've been told baby blues are real, and you've been told postpartum depression is real, and how wonderful it is that we normalize it. It still doesn't mean it doesn't necessarily get treated. And
Yes.
I do also think that we do kind of leave birthing mothers kind of in the lurch. You know,
Yes.
some cultures have the fourth trimester, or the time after baby is born, in which the mother is now mothered,
Yeah.
and her children are mothered. She gets to mother her children in the way that feels good to her.
Yeah.
If she has more than one child, where she's taken care of and food is brought and all these things that are very, very difficult to do on your own. I have an incredibly supportive spouse who's very capable. He's changed as many diapers as I have. That was never a question in his mind, if that was part of his life. So I had a very active husband. He'd get up with me when I had to nurse in the night. Sometimes I said, no, you go back to sleep. You need to be rested. No, I want company. Or no, it's bottle time. So I had a lot of spousal support, more than probably most. And I still fell down a well. I wasn't from the area and had no family in the area. And we had a baby about less than a year from the time we moved. And like I said, wonderful spousal support, and we had a few decent friends we had made. But other than prenatal yoga people who I'd met who were lovely, and birthing classes, we didn't know anybody. And I certainly didn't know anybody who could be I'm really, really struggling. I need a shower. The baby won't stop crying. I didn't have any of that. Kind of the cliche of that would be, you're part of a church group or a religious group or some sort of spiritual connection where they make the food train. And I hadn't been there long enough to establish any of that. So having no one to call when I was sick and my husband had to be traveling was really, really, really rough. And I know that contributed to it. I believe I would have had postpartum depression no matter what. I don't think there's anything that was going to stop it. Its degree of difficulty perhaps could have altered based on maybe more of that just physical support. Just emotional support is important. But I just remember wishing more than anything to just be able to clock out,
So if I just ask you, you say you did struggle with anxiety and depression beforehand, and then you had this postpartum depression, would you be able to describe a little of your symptoms? And for our, audience who's watching, is there anything different, or does the intensity of any of the symptoms go up when you're having postpartum depression? What made you think or realize, okay, now this is the time I really need to get the help, although you were already getting the help?
That's a really good question. So I kind of see two questions within there. The first one being, could I describe or tell a difference between kind of the anxiety, depression, panic, bipolar, mood, however you want to describe it, symptoms at their severity levels compared to the postpartum?
So
severity.
first is for example, whatever your symptoms were beforehand, right? So what were they like? And of course, you were getting, you're being seen by a therapist. And then how did they change when you had a baby?
My mood disorder manifests in cycles and waves. So, go through periods of time where I'm a little bit more, this is stable, right?
Stable.
A practical person who's really rarely rocked by things. I'm a bit more like this. And then I have periods where I'm much more like this, or I'm here. Um,
Do you have like bouts of crying, or you just shut down,
I
or
think I exhibit all the signs.
okay, okay.
But there's no, I won't say there's a pattern. It kind of depends. I do. Okay. So yes, I shut down.
Do you have
I
any triggers, any particular triggers that could cause them, somebody saying something to you, because sometimes that happens, you're
get,
too sensitive, you don't take criticism too easily,
yes.
or just
Okay.
stress. For me, for example, stress and being overwhelmed, that's what shuts me down.
Okay.
So,
All of those. So the overwhelm can really put me into like a future spiral, and then I can't come out of it. That's really, really, that one just gets me. And it is, as does decision making, which I think are generally kind of linked,
hmm,
particularly if it's an important decision.
the
I kind of,
urgency of the matter that
I
creates
get
stress.
paralyzed, and then I want to, what do they call it? Analysis paralysis, where I want
Yeah.
every information of
Hmm.
anything before I make a decision, because I don't want to make the wrong decision.
Yeah.
Because a wrong decision means that I was wrong. I didn't make the right choice. I gathered I did everything wrong. Like it, all the pieces line up, I did it wrong. And then I have to deal with the wrong result, right? Now I have to back.
Bashing that, the self-bashing
Yeah,
getting.
now I have to reset. Now I have to fix it. Maybe I hurt somebody's feelings. So now I have to go solve that problem, which I didn't want to, I don't want to do that in addition.
Yeah,
Like
yeah, yeah.
I feel terrible. Right. So now I have to go fix or repair or alter. And that feels overwhelming, because sometimes just, taking out the trash in the midst of deep depression is exhausting. And sometimes
Mhm.
you don't do
Yeah.
it. So the idea of, okay, I finally made a decision. I'm finally stepping forward, to then step forward and it all be terrible, or it feel terrible or seem terrible, and then still feel terrible, and then have to make that another huge amount of energy to then move forward again, just feels sort of impossible. So if I'm going to do this huge heaving of bottling of energy to finally make this one step, I really want it to be the right step. so,
As a child or as a teenager, did you have support? Did you
as a
did you have
teenager,
families? Yes, as a teenager, you had family
yeah,
support,
yeah,
parents, siblings.
I did. I have wonderful parents. My mom recently passed, but I had fantastic parents. I was an artsy kid, theater kid, wanted to dance, wanted to do theater.
These are the things people normally say. Oh, if you're having depression, go out, go dance, listen to music.
And you mentioned a few other triggers, and since I think
Mm.
those are important for me to always piece apart for myself and for other people, I think, to hear, oh, thank goodness I'm not the only one that makes me crazy. Yeah, unkind words, like some sort of confrontation,
Mm.
like someone's mad at you in the parking lot. I mean, just that can kind of like,
Oh, really?
yeah, that can kind of like send me into a tizzy.
How would you
Over,
react if something like that happens, especially if it's people you don't know, it's strangers?
it's that fight or flight or fawn
Yeah.
system. So,
Do you fight or do you run away?
usually kind of, I almost freeze.
Yeah.
So kind of that like alternative to screaming back and turning and running away. There's kind of this like, I almost acquiesce. I
Mm.
almost go, oh, okay, you're right. I'm sorry, even if I am 100% not in the wrong, and they've been 100% a jerk. That has shifted, honestly. Maybe with children, I've
Yeah.
become a little bit more willing to, you know,
Yeah.
perhaps let them know what I'm thinking in the moment. But even if I stand up for myself, because
Mm.
even if I know I am 100% right and this person really needs a good talking to,
Mm.
or even if I walk away proud that I didn't engage, no matter what choice I make in my reaction, I am still, and it lasts for a while. I mean, it
So
happened.
it's like a panic. It's a physical reaction that you have.
It's very physical. I won't say it's a panic attack. It's
Something
just,
similar, but it's physical.
it's a very it's very whippy, very whirlwindy, like kind of
Yeah.
up the back of my body, like starting at my like my anxiety when I was really, really young, and it's still true. my anxiety almost starts like at my tailbone. It's almost this weird like tingle that starts at my butt, like at my tailbone, and like ripples its way up my back. And it's kind of hot, and it's also just kind of this like buzzy, icky feeling. And
Yes.
and that's kind of how it manifests for me. Um, so yeah, those triggers are there. Um, you know, once once I had children, you know, the baby crying at times can be a trigger. I was very lucky that my babies were not colicky, or they would sleep, they would eat. I really had very little problems, but even the calmest, most compliant, easiest baby, you know, you put them down, they're asleep, and you just want to go sit on the couch and they start crying. And that cry sometimes can just like send you kind of spiraling a little
So
bit.
this is so important here. A lot of times people think that depression or anxiety has more to do with just your thinking, and it's just your mental, or yes, those bouts of sadness or crying, and shutting down. But having these physical symptoms, although we may know them theoretically, we read them, but to, to be actually aware of that sometimes we can have physical reactions. And there are people who actually have pain, they have abdominal pain, or they develop migraines, and so these are, or they have sleep disorders, and these are real physical pains which we think, oh, we just maybe need an antacid to recover from whatever
Yeah.
the stomach upset is, but it's actually the anxiety. It's actually the height of anxiety
It's
you know
absolutely amazing what they've learned, what anxiety or depression can do to your body physically that isn't like a traditional depression or anxiety. I mean, I have all the like traditional symptoms of depression or anxiety when they're bad,
yeah.
what aches or nausea or lack of appetite or too hungry or joints or, muscle tension. Like I can't, the amount of times I wake up from sleeping all night and
Mm,
like I'll have some muscle in my body that is
mm,
exhausted, as if it's been clenching all
yeah.
night, because it has been. Yeah, I mean, the
Do,
reason
do,
they
do you
suggest
have
it,
sleep terrors or nightmares? Do you dream a lot?
no.
Okay.
One of the main medication focuses for me is sleep,
Yeah.
because I don't sleep. I really have trouble going to sleep, and I really have trouble staying asleep. And that's just not um, a fire I want to play with.
So when you do sleep, you still get up tired.
I do, but I do sleep, and I really rarely dream, or I don't remember dreaming. Um,
Mm,
I am not out cold that I don't wake up to noise. If
mm,
my husband snores, trust me, I wake up. If my kids come in the room, I'm generally awake. I wake up to the phone. I might be groggy. I might be slower. But I do wake up, but I don't generally dream, and I don't generally toss and turn a lot. If I don't sleep, then nothing else I do is really going to do much good
mm.
for any of those other things, because
Yes.
no sleep equals all of those things get infinitely worse really, really fast.
Do you have any
Uh,
family history though?
Nothing has ever been officially stated. And I don't think anybody would know, but
Yeah.
it's generational. It's a lack of knowledge. It could just be that, my mom's side genuinely just doesn't have a lot of that there. I mean, my husband's an incredibly supportive man and his family is amazing, but they kind of, and he a little bit too, and he'll admit it. He's
Mm,
like, sometimes he's like, I don't really understand
mm,
um, mental health really knocking you so sideways that you can't get up. And
mm,
he does, because he's watched it and he sees me and he
mm.
believes it.
I think that's so important to have a husband like that. And it's, I mean, I just want to say it out loud, shout out, give him a shout out. There are men who support women, but not that many. So we were talking about postpartum. So you were three months in after your baby. So what exactly you think happened, uh, where you were like, okay, no, I really need to get treated here?
Yeah. We went on vacation. So we lived not near our family. And so Christmas came and we went home for Christmas. And I am from California, where it's nice and warm, and we lived somewhere that was not warm at all in the winter. And so I got home to
Mhm.
family, getting out of my apartment and my house. and the cold
Mm,
and being around people, being around safe people.
mm, mm.
um, I think it started to unravel. And I think that they saw my sadness, get irritated with the sweetest 6 months old. They're so easy. Like, well, my 6-month-old was rather easy, right? They can kind of crawl, but they're really happy to just like stare at stuff. They're not getting into
Yeah.
things. Couldn't walk yet. They're just happy to be entertained in the easiest way possible. And my mother, at one point, in the nicest, kindest way, she was angelic in what she could say to people. She really had a gift. Was something along the lines of, you know, what's going on? You know, like mother's intuition that
Yeah.
something was wrong.
Yeah. The thing
And
is, you're on a vacation and you've had a baby, and that's what people would say, this is a happy moment.
yes,
You have a baby, you're a mother, you're enjoying, then you're on a vacation, so
mom
why are you
vacation. It's
happy?
Christmas, right?
Why
Yeah,
are you not happy? That's the question.
yeah. And and that started to make it real to me. And then and when I started to be able to feel other people in the room feel it, when the vacation was over, I actually chose to stay
Mm,
because I didn't want to go back to the cold. I didn't
mm,
have a job. My
mm,
husband was working. I mean, normal. But I didn't want to go back. I didn't want to go back. And it was partly because it was really cold and I wasn't used to it. And it was partly because I didn't want to go back to that life.
mm,
And that was kind of my escape. And my whole family was on board. They're like, yeah, why don't you stay? It's like 0 degrees for the next month. You don't need to go back. Like, yes, your husband will miss you. We had to have a conversation
mm,
where he was, yeah, that's going to be hard to miss you and my baby, but I get it. There wasn't a need to go back. There was more of a need for me to be around family and have that. I need to go shower, but I didn't get better.
mm,
And when I finally had to go back, I was probably there another week. I got back, went to my therapist, and I don't know what I said or what occurred, because at some point it is now all not even a blur. It's like slowly been erased from my head.
which is a
Uh,
good thing.
she
It is
said,
good.
I'm calling this place I've told you about, and you will start tomorrow.
Yeah.
And that was a huge shift and a huge relief. It was, oh my gosh, this is bad. It's so bad that I have to go now be part of an outpatient program at a hospital. That's
Yeah.
how bad I am.
Yeah.
But I also finally was heard. Someone finally figured out something was wrong. And while it's wrong enough to require that kind of treatment, I'm now going to go get treatment.
Yeah. Yeah.
Almost like you run a low-grade fever for a few days, but you're not sick enough to not actually go to work or school. You just
Yeah.
want to actually have the fever and be sick enough that you get the credit for being sick. So that was a big turning point. And I wish I could tell you something more specific about me that got me there. And it was me going home and seeing it outside the lens of my own apartment and seeing how I interacted and how I felt in an environment that I knew and loved, that was full of joy, that was excitement, that was lighthearted, and I felt none of that. Even that's right, even my sisters had a friend, she'd had a baby a few years before, her friend had, and so they at the pool, they called me over and they're like, come on, let's chat, what's going on, trying to do a more casual way, and I shut it down. I remembered, I'm not talking to you about this. I'm fine. And even if I'm not talking to you about it, like, and when that was coming out, I went, oh yeah, there's something going on. So it did take a complete meltdown for me to get the help I needed. And I want to just presence, talking about how supportive my husband is and how supportive my family was. They weren't like, oh, baby blues, you'll be fine. There was no dismissing it. There was not brushing it under the rug. It was, in fact, they were doing the opposite. They were like, we see something and we think there's a problem. And I had one of the best setups you possibly could. I knew I had a history of it. I had someone watching for it. I was talking to somebody about it. I had everything lined up, and it still hit, and it still hit in a way that wasn't caught right away.
This is such an important message. This is such an important message for everybody.
Yeah. And so I
You,
say that because if it hits you, even though you have everything perfect to stop
Yes.
it, it's not that you didn't do enough to
Yeah.
prevent it. It just was going to hit.
Yeah. And plus, were you already on some kind of anti-anxiety, or you were not at that time?
I was.
You
Yeah.
were. So see, that's what it is. It can happen anytime. It's not that it's something wrong with us. It's yes, we need help there, and it's okay to get that help. If your blood pressure is going up and it's not coming under your control, you can't control it. You need to get that medication to control it, right? If your diabetes is not in your control and you're trying your best and it's not coming in your control, what do? You finally go to the doctor, right? And so that's the same thing with mental health. We really need to understand that. Beautiful, beautiful share here, Courtney. One thing that was coming to my mind was not having a job. You mentioned that at some point. Did you always work, or was it during the times when you had the baby, you were not working? Was that an issue at some point in your mind?
That's a good question. I'm a little bit of an odd case because I did not, my background is really creative based.
Hmm.
So I never held like kind of a traditional corporate job or even business type job. I did theater, I taught voice, I worked in theater, I did temping, I did kind of odd jobs here and there to be able to pursue that piece. I got married and was able to pursue that piece. I did work part to full time, depending on where our finances were at the time. I ended up managing a Pilates studio for quite a while, just slowly, something that just kind of came into being. But I did teach voice. I built a business. But when we moved from where we were from to the place where we had our first child, I didn't have to work because there was a pay raise that came with my husband's job that brought us there that really allowed me to not have to work at all. And we were pregnant. I was pregnant right away when we got there. So it just kind of made sense for me to, I wasn't going to go get a corporate job to then go on maternity leave and then go back to a corporate job. I didn't need to. And there wasn't a job or dream or some sort of attainable goal via having a job outside the home, if you will. So I'm kind of an odd case because I didn't have a career, take time off, and then go back to a career. I didn't miss a career.
And you didn't miss it. You didn't miss also.
Yeah. So it was like I got to be home by choice without the pressure of, can we afford this? Or the pressure of, but I really also want this thing too.
Yeah.
I didn't have that. So I may not be as
no, that's good. That's fine. It's not odd. The reason I'm saying is because for a lot of women, especially who are not working, right? People do expect that, okay, because working adds extra pressure, because now you're juggling two things. You're juggling home and you're juggling work. So a lot of women who work, people think, okay, yes, they have a reason to get depressed maybe or get overwhelmed, okay, but you're at work. And sometimes women who work and then they become homebound, they develop this frustration because they want to go out and they can't, or they want to socialize and they can't, or they want to feel productive in some way and they can't, right? And so it's very important, to understand that that's not always the case. That's not always the case. You could be a housewife. I mean, although I don't know if you would define yourself as that or not, but still have depression, right?
Yeah, I remember wishing I had a job. Like I remember wishing that I could get up and drop him off and have someone else take him for the day.
Yeah.
Because that felt more fair and easier. That's not fair, and it's not easier. To my working moms, that is not an actually thing I think of is true. But in the moment, I remember going, man, I wish I didn't have to do this all day. And I've had conversations with women who do and have worked out of the home, who had moments where they're like, oh my gosh, I really wish I never had to go into the office ever again because now I have to deal with my boss. Or, you know what, I decided I don't want to miss out on these years. I'd rather go back to work later. I mean, so both sides of that coin have stressors and guilt and shame and pros and cons. And so but Yeah, it all, but I will say it does add a different layer to
Mm,
postpartum depression or maternal depression, if you will, when you're really struggling with kids, when you're at home and people, either kindly or not, or ignorant or not, or like, but you're home, like you chose to do that. So that's kind of like comes with the show, lady. Like that's
mm,
part of
mm,
um which is true, but it doesn't also it also doesn't negate
mm.
the struggle you're having, like, you know,
Yeah. How is
I
your
want
depression now? How is your depression now?
it's a little challenging right now with my mom's death and kind of how it
But
happened and a few other kind of significant
her death
health
has been recent,
has
your
yeah,
mother?
yeah, it was mm, 5 months ago, 6 months ago,
Very recent. That's very recent.
which
I'm very
to
sorry
some
to hear.
people is distant and it's better than it was a month after, but and there've been some significant family health issues since on both sides, so it just it's been a hard season, if you will. I kind of joked that at the end of 2022 I was gonna like throw a grenade behind me and like walk off into the sunset because the year had just been so terrible. Or
Mm,
2022
yeah.
last of it was just really rough. So my depression's not been great. I mean, this is a season of harder compared to other seasons for sure.
What have
And
you learned? What have you learned over the years? How do you control? How do you manage?
for me, because I want this to be helpful to those this is helpful for, and for the people that it doesn't sound helpful for, there is someone else who will speak the
Mhm.
things that sound helpful to you. To me, it took me a very, very long time to realize and accept that the way I am is the way I am going to be.
Mhm.
There is no cure. It isn't like, well, I'm 16 and I'll take some meds and my hormones and then I'll get into college and I'll have something to say, look how successful I was, whatever that is. No. The toolbox that I have to manage daily and sometimes hourly depression or anxiety or panic attacks is a toolbox I've had for a very long time. It occasionally grows a little bit, but it's almost a full-time job at times to
Taking care of yourself.
take care of myself and like heal my, I won't use the word trauma, but heal the disequilibrium that is so strong inside that I can't really even walk straight. Like I don't know if that analogy kind of works.
Any, if you can give out some of these tools, do you know? Can you identify them?
Yeah. So, first of all, medication and constant vigilance of that medication. What are you taking? Do you feel different? Do you feel better? Does something seem to have shifted? Um, what and someone that has a vested interest in um being on top of your medications, like, hey, this came out, this is really new. I know some people don't want to do new, but I know you've been struggling with this. Or hey, you went through this really difficult season, maybe we need to up some things, but hey, it looks like you're doing better, let's back down. Someone who listens to you but who also knows their stuff, so they're balancing what they're hearing from you and the knowledge that they have, so they can really put forth, no, I really think you should do this, but also can listen to you when you say I don't want to do that. So medication, therapy, mindset, brain tools. I mean,
Mindset
the
tools. Yeah.
the reframing thoughts. I mean, I know NLP has worked. Try them.
Yeah.
Go find somebody who does it. Try it. Find an apprentice. Try them because they've been out long enough, and I know people who've really had success with
Yeah.
them. They're not something I have tried extensively yet. It
Yeah.
is now something I'm going to pursue. Um, and then little things here and there I've picked up, like the acknowledgement of how I feel at that moment or in
Mm.
the morning when I wake up. Wow, I do not want to get out of bed. And sometimes just saying what it is you are feeling. I am feeling X. Um, or expressing your wants or non-wants. Wow, I really
Mm.
want ice cream
Mm.
if I want. to get out of this bed,
Mhm.
can be helpful.
Being mindful, being aware,
Yeah,
that helps.
being aware. I find being mindful very, very difficult the more wound up I get, either on the high side or the low side. So sometimes I try to view it in as simple as speak
Yeah.
whatever it is I'm feeling
Yeah.
out loud.
Yeah.
That mood disorder wants to fight being healed
Yeah.
or
Yeah.
being
So
pushed
like
back.
for me, when I have that kind of a thing, when I start in that spiral, my mind starts racing and, spiraling. So for me, when I talk about being mindful or being aware, is that I go like, okay, so this is what I feel. And, and I'll just go like, okay, why am I feeling this way? So to be very specific, because say, for example, if I'm getting angry, right? And now maybe I'm getting angry at the kids, but I realize it's basically because, say, I have work piled up and I'm overwhelmed. And at the back of my mind, I'm worried when that's going to get done and my kids are taking too much of my time, right? So I'm not really angry at them. I'm getting upset because I'm worried about the work that's piling up, right? So for me, when I am able to identify that, then I go like, okay, so I'm getting angry because of that, and it's not them. So okay, whatever time they need, okay, 10 minutes or 1 hour, okay. I literally then give them that block. Okay, girls, you have this 1 hour. Let's do this in 1 hour because mommy needs to do this after this at this time. So like when I'm tired, sometimes you wake up, you're tired and you don't know, you're just upset because you're tired or you don't want to do stuff. And then I go like, why, what exactly do I need? Why am I tired? Did I not sleep well? Or do I need, maybe I'm hungry, or maybe somebody said something which I didn't like. And now I'm in that, my mood is not good because, say, my husband said something to me or my friend said something to me or my mother said something to me, and they didn't mean it, but it's there in the back of my mind, and now it's draining me. So when I'm able to identify that, exactly, then it makes my life easy. Okay, so this is what caused it. Now when I'm trying to deal with it, other people don't become a victim of my behavior.
So I'm so glad you brought that up, because you asked how my depression has been, and it's been a struggle. But honestly, what you just described, I think, is the bigger struggle I'm dealing with right now. It's almost like being in the depths of depression is horrible.
Yeah.
Being in the depths of anxiety is horrible. And each time I'm in the apex of one, I'm like, I would do anything to be in the apex of the other, because this is awful. The mixed state is where you really start to kind of lose your mind. I think that's the absolute worst, when you're literally in both at the same time. And that is very difficult to explain to people and very difficult to describe. It's almost something you have to experience at the same time. But to your point, when I'm really struggling, when my mood disorder is really kind of winning that battle, no matter the tools I put into place every day, or that I don't do so well some days, or I do incredibly well some days, when it's winning, that is where I get in the most trouble. Is it eats whatever's really upsetting me, eats everything else, and so it bleeds into everything else.
Yeah.
And so then people are suffering the wrath of me being frustrated about something completely not
It's
really,
not their fault, or they're not even aware of it.
or my kids did do something that warrants me being irritated, but I'm now overly irritated, and thus I cannot communicate in a healthy way about that, because I'm still stuck over here, even though I'm trying to deal with here. So I'm glad you brought that up, because that is not something I excel at.
That's what one of the tools that I use, because what it does is it kind of grounds me. It grounds me to the moment.
Okay.
So like, for example, if I'm upset or sad right now, or if I'm VP right now, I'd go, and literally there will be things that I come up with. Okay, I'm feeling this way because I'm cold. And I realize it's just because I'm cold, and I'll go and I'll turn the heating on, or I'll go and wear a jacket. Or I'll go like, oh, I'm feeling this way. What do I need to do right now to feel better? Okay, maybe I'll eat something. Maybe I'll just watch TV. Maybe I need to call my mother. my sister, so being in the moment, what do I need now? That helps me. So sometimes I'm not thinking, like, going deep into it, what caused it or what's happening or why am I in my depression or
Yeah.
why am I in this frenzy, because it's too much. You can't. So I just go like, okay, what is it that I need now? And sometimes it's little things like, okay, I need to rest. I need to be in bed, okay? And I'll just go and hit the bed and I'll go like, leave me alone. My husband will come or my kids will come and say, can you give me like 10 minutes? Can you give me half an hour? I just want to maybe relax my body and, let whatever is stressing me out flow out of it,
Yeah.
and just let me be. I just want to go and lie in bed, maybe cry, weep in my pillow, nobody knows. And then I'm up and then I'm smiling and I'm normal, so because I know it's not their fault and I don't want them seeing it and feeling as if they've done something to cause it.
Yeah, that's beautiful. You said something and it totally clicked, and then of course my brain just immediately stopped remembering what it was. Was one of the last things you said. Oh, just that, if you go cry and weep and then you get up. And that is another tool I think I would put out there that I have found of benefit is to you can't fight it.
Yeah.
You can't fight how you feel. You can fight with tools to maneuver through.
Yeah.
But you have to kind of surrender almost to an extent for it to pass. So, the kind of cliche Hollywood movie, go eat a pint of ice cream and cry on the couch when your boyfriend broke up with you for 3 days. It kind of works to an
It does.
extent.
It does. It does. It
It's
does.
when it's a depression that's clinical and based in brain chemistry, it's a little bit different than, the dissolving of a relationship, which, believe me, I know sucks and hurts. So it's a little bit different because there's sometimes not an exact thing you can pinpoint to.
Yeah.
You
My
just feel
last
that.
depression actually went up to 2 months, and I knew it went too long, but I was like, okay, if that's what my body needs, that's what my body needs, you
Yeah,
know?
that's
And that's what it is, identifying what you need, because it's not always about what's caused it, because you can't change what's caused it. Something caused it. You can't change that.
or you don't know what it was.
Or
Um,
even if you don't, even if you do, it's just too much of
yeah,
work, trying to figuring out and then trying to work with that. That's not, you can't do that. It's like going in another spiral. That's another emotional
yeah,
spiral.
it's
So
and that it's a lot of work to
it
identify.
is.
And when I've done a lot of therapy,
Yeah.
and one of the things, is kind of common is like, well, let's talk about your past, or let's talk about,
Mhm.
why does your husband saying X make you upset? And sometimes it's pretty obvious. It's like, well, I just wish you would clean the dishwasher instead of saying
Yeah.
X.
Yeah.
Whatever. But sometimes there are things that and people meaning well, and because these tools work for some, is to dig.
Yeah.
We can
Yeah.
dig to the root and we
Yeah.
can cure the root, then you won't feel this way anymore.
No, no, no. For me, it's the opposite. I relive it all over again.
Yeah. I I would dig and dig and dig, and I couldn't find anything. I have a good childhood. I don't have any trauma that I'm aware of. It's clearly chemical. Like, I mean, you can take all the tests you want. There's definitely chemical stuff going on. It doesn't mean there aren't external reasons, but I would get to the point where it's like, there's nothing I can tell you. I can't explain to you why I am this way. There's nothing to find. And so if the only way to solve or attack what I am dealing with is that I need an answer,
Yes, to give the tools to do
I
it now.
if the only tools I can have are ones that go towards a specific answer, then we're not going to get anywhere because I don't have an answer. And I
Yeah.
finally spoke to somebody fairly recently who was like, the reasons don't matter anymore.
Yeah. Yeah, they don't. Yes.
Mine is to go forward and to give you
Yeah.
help to maneuver through when it's bad and when it's good.
Yeah.
And if you never understand the blocks, if you
Yeah.
just if you can just look at the dragon, you go, oh, there's that dragon, but you don't need to know who the dragon is or why the dragon was created or what he's the dragon of. He
And you
just
can't do
exists.
anything. It's there. It's there. You can't do anything with it.
And I can't defeat him. So
Yeah.
what are the things? Am I going to offer him a cookie? Am I going to go around? Is this the day I bring my sword and a shield and I threaten him? I don't, but learning who the dragon is and his motivation to use
Yeah.
theatrical thing doesn't help me. Like, I just need to know how to go around the dragon.
Yeah.
I
Yeah.
need, I need to know how to befriend the
Yeah.
dragon, know
Yeah.
when to tell the dragon to bite me. I need,
Yeah.
I don't need to know why the dragon exists and what he wants
Yeah.
from the world,
Yeah.
and some people do, and that has worked wonders for people
Yeah.
to know why
Yeah.
that dragon
Yeah.
exists. But I've spent way too much time at this point
Yeah.
to identify dragons when I just need to know how to
Yeah.
maneuver through them.
Yeah.
I
Yeah.
would say to some people too that maybe you're not looking for an answer of why, you just need the answer of how to.
Yeah. That's true. And that's what I was saying. For me, it was the opposite. When people say journal it, or I actually relive it. And if I'm imagining a dragon, then I'm actually imagining facing him, and I'm reliving that whole thing, and it doesn't help me. People say journal, people say talk. I go like, if I journal and the more I share, the more I tell, it's like I'm actually reliving them all over again, and I've brought them all back again. So for me, it doesn't work that way either. Yeah.
I'm glad to hear I'm not the only one, because I have had a lot of struggle with that in the
Yeah.
past.
Yeah.
And since this is kind of a topic of endurance, I wanted to simply mention, with my second pregnancy, at the end was when I basically hit panic attack mode, and the sun would go down and I would go into panic attacks because my first son's birth was rather traumatic. I didn't realize it at the time. But everything kind of went poorly after he was born, and it was nighttime. And so I think my body just did this very simple thing of, oh, it's nighttime, baby's due. So, and last time baby was due and came out, I ended up quite sick and in danger. So my body just decided to put me in a panic attack. And so enduring through that for like a month was absolutely brutal. It continued for a week or two after he was born. And that was rough. That
Your second pregnancy was not difficult. Your first one was, but your second one was okay.
Delivery
The
was,
normal.
yeah, second one was compared to like a piece of cake. And he was 2.5 pounds bigger. He was significantly easier to deliver. But there's so many complications that occurred with my first, significantly postpartum, after he was, several hours later, when things aren't supposed to go wrong. And so when you have a hemorrhage, they found something called HELP syndrome, which basically meant
Your liver enzymes are up. Yeah.
enzymes are up, and if you don't solve it, your body will shut down and your organs will stop. And so it's a significant enough problem that they have to address it immediately. So there was a lot of stuff that ended up being done to me, and even though they were telling me why they were doing it and what they were going to do, there still wasn't really a choice. Not that I would have said no, but there's like a little bit of that trauma of just being in a hospital and things just being done to you. And that was difficult. There was a DNC that ended up having to be done, but it wasn't supposed to happen the way when it did, and they had fed me, so they had to, and they didn't know, and so then they had to intubate me, and I really didn't want to be intubated because I'm a singer, and I was just also just like freaked. I was basically freaked out by everything at that point. Everything was deadly. Everything was terrifying. And so I was in the and then I ended up with blood transfusion. So I was in the hospital for 5 days after he was born, and then I got home and I couldn't walk. I mean, I couldn't make it from here to there to that curtain by myself for at least a week, if not 3, when I came home with my son. So I had a great postpartum at home, in the sense that I had full-time care. One parent came from one side of the family for an alternated like weeks, and I literally was handed him when he was hungry, and then they took him back, and then I went back to sleep to heal. So and then everything got better. That was the thing that sucked about the postpartum depression hitting, was it all got better. Like I was so sick and so scared, and then I slowly came out of it, because I slowly came out of it when he was, a month, 2 months old, and they're smiling and they're looking at you. And I had a few months of what the vision of motherhood with a baby is. And then it all slowly disintegrated, and realizing that I'd had this thing that I defeated, this birth that just really, really rocked me sideways. And I came out of it and everything was great. And then for it to fall apart again was really hard to recover from. And I know that when we talked before, that I think when I think of enduring through something or it continuing on, it still hurts at times. Like it doesn't it isn't like a movie where like,
It hurts every time.
yeah, where it's
It
like,
doesn't.
oh, tough, the montage is over and now it doesn't bother me anymore. It
Yeah,
still can bother you. It still hurts.
yeah,
Uh, and you don't feel strong. You
yeah,
feel weak and you don't want to be strong because being strong hurts. That I would rather be weak because this hurts like hell and this is too hard and I don't want to do this anymore. So I think I got a little off topic there, but
No, no, you're good.
I know we had
This
talked
is
about
what it is. This is what it is, and this is what people need to know, that we're all in the same boat, but some of these boats are more rockier than others. And it's okay.
and they come back.
And
When
we all come back, and we're all here. We're all still here, and we're all still raising our kids and trying to survive and trying to be happy.
and that has echoed throughout my parenting, that anger or
Yeah,
confusion or sense of grief
yeah,
from the or labors
yeah,
lingers,
yeah.
even to this day, with how old my children are, to sometimes make me question, am I good at this? Do I want to do this today? If I don't want to do it, can I still do a good enough job that I need to do when you do something you don't want to do? So it's just,
So
it lingers.
knowing that you have an issue and then still you're doing it, it's a good enough job. Okay. So like, give yourself this acknowledgement that, you know, with my depression and anxiety and with the history that I have come so far. And if have come so far, the next 10, 15 years will pass on too. I can do this. If I could do this for so long, I can do that. It could get easier or it would stay the same because you're growing with time and you're learning tools with time, right? But hopefully it won't get worse. Hopefully you won't let it get worse. Do you feel that way? Do you feel that way? Do you feel in control in some way?
That is a difficult place for me to get to. So it's something that I need to make a concerted effort to feel that. Um, you know, my mom dying kind of made everything spin out of control because all of a sudden there was this, anchor that didn't exist anymore. So if you talked to me, last January, I probably would have had a different response to feeling strong,
Yeah,
or feeling in control,
yeah,
right? Because she died, a bunch of other stuff happened. My husband has a new job. He's going to travel a lot. I've got 2 kids. They're in school. You know what that's like. Like nothing feels in control. Like the amount of email I get from school that rules my day
yeah,
is
yeah,
massive.
yeah.
So I would like to say that if we talked again in 6 months, that my my response to that question will be different.
That is how life is, because things will not always stay the same. There will be things happening. Like, for example, your mother passing away. Uh, it was bound to happen sometime. We may not be expecting it. We don't want it. None of us want that, but things happen, and things will happen. And worse things can happen. We're not anticipating them. We don't want them, but we don't know. Life throws stuff at us, right? And that's what makes us stronger because whatever life throws at us, we endure it. It was so nice speaking to you. Okay, so I know it's been over an hour now. We can a few closing lines, and I just wanted you to kind of share a little bit about that program that you had, like, because I want people to know that there are programs or they can find programs which are specifically for postpartum.
Yes,
Okay.
absolutely. I was in a metropolitan city at the time, so it was through there. Or you know what? It's okay. I can say specifically what it was. I don't live there anymore. It was the Hennepin County Medical Center. Hennepin County is where Minneapolis is located in Minnesota.
Mm-hmm.
And it is called the Mother Baby Program at the Hennepin County Medical Center. It was an outpatient program. So you went like 9 to 3 every day. If your baby was under a year, you could bring them.
9 to 3. It's a long day, the whole day.
But it was awesome because that was 6 hours that I had my baby with me, maybe, but there were other people. And so there were moms who were struggling with being moms, but were happy to bounce your baby on their knee. I didn't want to touch anybody else's baby. Like, I was babied out, but there were people who were like, oh yeah, totally. And they would snuggle him, or some of the therapists would snuggle him. So he got like and there were toys, like there was the best life for him during the day. And I was supported. So I was more willing to mother a little bit because I had the support. So it was for postpartum depression. I don't know what the age limit was for the age of the children to be considered postpartum. But the women in there were for all different reasons. They were all postpartum, but they weren't necessarily me. There was postpartum psychosis, and there was a woman who sent to gun violence, her oldest son to gun violence when he was a teenager and just had a baby. So her postpartum wasn't about her baby. Her postpartum was connected to the death of her other son. But they were all there for different reasons. The group therapy, what did they say? It's the people who aren't talking are the ones who get healed when you sit in a group, because you think you need to share everything. And really hearing other people's story makes you realize you're not alone. And it makes you grateful for what you have, because my goodness, my story could have been theirs. Right. And just the kindness of all the other people, and watching them fall apart and watching them be strong. Like it just, everything was powerful, whatever it was that day. And so there were several therapists. There was a psychiatrist who would talk with you about certain things, and they would be the person who kind of in charge of medication. And then the therapists, and you had one that you kind of dealt with, and they all communicated all the time. There was so much information going back and forth. And then when you were ready, you were usually there for 3-ish weeks was the rough, graduation rate. And then when you moved on, they had connections to therapists and medication managers so that you weren't left hanging, and they had direct contact. So you were no longer in that program, but the person who was taking you on as a patient was very familiar with that program and was able to go back to them and talk. So I felt like I always had, at least 2 or 3 degrees separation between me and the women who really changed my life. So it is not the only one of its kind. They do exist. I won't lie, you might have to dig a little bit to find.
You'll have to look in, I believe, in your own hospitals, the community hospitals that you have in your city or your county. There would probably be some kind of programs, there should be.
They definitely are. I mean, certainly in the bigger areas. I would also suggest Postpartum Support International is a large organization. I've done a little bit of work with them. I did a concert actually at one of their events. That's actually what that board is up there, is it's my maternal mental health concert awareness concert music. But they have branches everywhere, and there's usually some sort of volunteer representative who will say, oh hey, here are a bunch of the therapists and doctors I know of in the area who are a member of PPSI. So it's a big website. You can get on, they have resources for everything. So I mean, just a website. If you want just a website, start there. But you can definitely reach out to local representatives and actually get a human. So that is one I do have experience with, that I do recommend. And that there is help, and there are people who want help
and
you.
that you're not alone, and that you're not alone. And there is help.
If you don't find it at first, don't stop. Please keep going. And if that means you need to call postpartum support and say, or whatever organization you find, I want to stop, I can't find anything, I'm stuck, give it to somebody to do it for you, and let somebody help you find what you need. You know what I mean? Like, I've had one of the most humbling moments of my life was having a kind of a distant family member through marriage. We always got along very well, but we didn't live near close, and weren't all that close. She reached out to me because she was having significant depression and wasn't sure what to do or how to handle it or how to tell her family. And the fact that she reached out to me about it was like a humbling honor, right? That I had obviously made some sort of impact to her somehow about my talking about it, that she felt she could ask me. And I was like, here's all the things I can tell you and you can do. And then I followed up with her, how did today go? Were you able to find anybody? So
There you go. You built a support system there too. Now you both are there for each other,
yeah, that was a good thing for both of us to build that. That was longer than a few sentences, but anyway, yes, these programs exist.
Yeah,
they do. There are people who want to help. There are people who want to medicate you, whether you're pregnant or nursing. It's not the end of the world. There's lots of science. There's lots of safe stuff. Don't be afraid of that.
Thank you so much, Courtney.
Yes,
that was extremely brave and courageous of you to come and share your story. And I'm sure a lot of women are going to get something out of it, something from each part. If you just literally recap, you've had a history of anxiety, depression as a child, with no family history of any mental health issues in the family that you're aware of. And then you've been under therapy. Then you had a postpartum depression, I believe, both times, right? And you got the help that you needed. So there is help out there. You also endure the HELP syndrome. It's a very high risk condition. She was bleeding, and that's dangerous at that time. And so for you to come out and share this, it's thank you very much for that. There are no words for it. And I hope you get all the help that you need and you're able to do well in your life with your kids. There will be a point in time when the kids will grow up and they will literally acknowledge you and honor you for everything that you've done, knowing your struggles, because it's important. It's important for the kids to know that they're not just born and we just don't raise them. It's an effort. And it takes a lot of time and it takes a lot of effort. It takes a lot of emotional, you're literally suffering, and so whatever we mothers are doing, don't take it for granted. Don't say, oh, everybody is doing it, so it's okay. It's no big deal. It is a big deal. It's not easy to do, whether you're a working mom or you're a stay-at-home mom. We will have another guest next month, and then see you there. Thank you. Take care. Bye-bye.